Medication Coverage in BC 2025 Update, Building a Path Toward Equity. In January 2024, the Gastrointestinal Society released a report that shed light on a significant healthcare gap in British Columbia. This inequity is denying BC patients coverage of more than 30 essential prescription medications that every other province across Canada covers. Health Canada has approved these medications, and our National Health Technology Assessment Body, called Canada's Drug Agency, has recommended them for public coverage. They also have a letter of intent from our price negotiating body, the Pan-Canadian Pharmaceutical Alliance. It doesn't make sense for BC to not cover these needed medications. After the release of our report, we had months of meetings with government officials, and we received promises for change. Despite it all, there has been little progress, and we have heard even more stories from individuals who are struggling. Of the more than 30 medications that BC has refused to fund, they have made only 4 potentially available through special authority. However, this means unnecessary delays and barriers, more administrative work for our strained healthcare system, and no guarantee that patients will get the treatments they need. BC is ramping up its investments in all other parts of healthcare except the provincial drug plan, known as BC Pharmacare. The 2025 budget reveals there will be no increase, not even $1, for the next few years for the Pharmacare program, which has been historically underfunded. This affects care for people who rely on life-saving medications, and for those living with conditions such as cystic fibrosis, diabetes, psoriasis, and more. For some people in BC, there's simply no alternative. This is the case for children living with short bowel syndrome. The only medication available, DIGESTIVE, is a Canadian invention that promotes regrowth of the small intestine. It is covered publicly across Canada, except in BC, where there are approximately 32 children living with this condition. Some of these children need surgery to remove damaged parts of their intestines, and others might need intestinal transplantation. Typically, they cannot eat or drink. To receive essential nutrients and survive, they rely on total parenteral nutrition, or TPN, for months, years, or even a lifetime. With TPN, they receive nourishment through an IV tube that bypasses their digestive system. We don't agree with the BC government that TPN is a way to live, especially when a medication exists that allows these children to live full, normal lives. Multiple sclerosis is another affected disease. Approximately 17,000 people live with MS in BC, and for many living with relapsing remitting MS, Kesimpta is a lifeline. It is the only monoclonal antibody available as a once-monthly, self-administered injection. It gives patients the flexibility to take their treatment on their own schedule, without traveling to a clinic or taking time off work or school, which is especially helpful for those living in rural areas. It also helps reduce the financial burden on healthcare and social systems by minimizing relapses that require hospitalization and preventing loss of employment. BC has yet to fund it, despite its approval and success in other provinces. We must do better. We're asking the BC government to recognize the impact of these ongoing inequities, to act now, and to invest in the lives of British Columbians who are suffering. We're ready to work alongside the government to find solutions and create a system where everyone has equitable access to the best available care, no matter where they live in Canada. Join us in asking the BC government to step up. To learn more and make your voice heard today, visit badgut.org to view our full report. Thank you for watching.